Okay, with regard to data, okay, which involve privacy and confidentiality as well, most of the time when we conduct data collection, okay, maybe for research, maybe for organizational diagnosis, or maybe to know or to develop interventions, it sometimes involves some form of recording. So standard 4.03 in privacy and confidentiality stated that before recording the voices or even images of individuals to whom they provide service, okay, to our clients, to our clients, to our patients, for example, psychologists obtain permission. Okay, we obtain permission from all such person or their legal representative. Okay, if involved with someone who are unable to give consent, it could be minors, it could be people with not in a good state of mind, okay, insane, for example, unable to think properly. We must seek permissions from their legal guardians or legal representatives. So this standard 4.03 should also be read together with standards 8.03, standard 8.05, and standard 8.07. So these three standards are with regards to research. Okay, with regard to research. So we are going to discuss in more details later when we come to discuss about standard 8 on research. Okay, this standard 4.03 in APA Ethics Code, okay, this standard addresses the ethical responsibility of us when we want to make audio or visual recording. Okay, this may involve individuals in research context or in intervention context. Okay, in this standard, it basically protect our clients, okay, protect their autonomy, okay, protect their privacy and dignity by requiring us to explicitly obtain their permission, okay, before any form of recording is made. So the core purpose of this standard is basically when we do psychological service, we often involve deeply acquiring personal information. Okay, so this may involve sensitive disclosure and emotional vulnerability during data collection process. So recording without permission would violate the client's rights, okay, may erode their trust and create risk of harm. Okay, so therefore this standard mandates, okay, our mandates us during our practice that we must first obtain consent before recording, and second, we must ensure that individuals that involved in the recording, our client, our patients, understand what will be recorded. Okay, it could be image, okay, it could be audio only, it could be video as well. So this also we must secure permission. Okay, if they are unable to provide consent on their own, we must secure permission from their legal representatives. Okay, if our clients lack the capacity to provide one. So these expectations mirror fundamental ethical principle of respect for a person's beneficence as well as fidelity. Sometimes people don't pay enough attention to acquiring permission for recording. Okay, because of why? Because they think that there is no sensitive information, they know confidential information that we require. Okay, for example, in research, they only report in aggregations, okay, not referring to any individual, for examples, but still we must obtain permission if we want to record anything, audio, visual, or image. So why? Because obtaining consent for recording is essential. Because when during recording we capture highly personal content, okay, and this content, okay, may be transmitted, okay, electronically, and when we use this kind of platform, sometimes it's out of our hand and it may create security risk. And this kind of information also maybe can be used with other third parties, okay, with other people, okay, not only you and your client or the individuals. Okay, it may be used for supervision. Okay, your supervisors want to see how you conduct the sessions, the determination, for example, the discussion, the focus group discussion as well. Okay, may be used for training, may be used for consultation, or even documentation. So because of these all affect the client's willingness to disclose their information. Okay, we have to know that when we when we inform our clients that we are going to record, okay, their video, the audio, or the images, okay, our client may react differently. Okay, this also been found in research. Okay, so research indicates that clients may communicate differently when they aware they are being recorded. Okay, and during the informed consent process, okay, this allow our clients to make autonomous decisions about participation. Okay, they may withdraw their participations, or they may involve with condition. Okay, for example, they are going to participate but they don't want any form of recording to happen. In terms of legal perspectives, so recording individuals without permissions may violate federal and state privacy law. Okay, so you have to be careful with that. So this standard, okay, standard 4.03 aligns psychologists' conduct, okay, our action with legal requirements by explicitly grounding the ethical duty in informed consent procedures. Therefore, we should first and foremost explain why recording is being requested. Okay, we also need to describe how recording will be stored and will be protected. Okay, all of this information, and we must specify we must specify who will have access to this recording. Okay, if say for example it's involve training, who are the other people, okay, parties who are able to access, okay, supervisors, for example, or other researchers and collaborators. And then we also need to clarify whether the recording is voluntary or it's basically made compulsory for certain procedures or protocols. And we must also allow our clients or the individuals to withdraw consent at any particular time. Okay, if you involve in interview, for example, you must be vigilant. Okay, you must pay close attention when your clients say that this is off record. Okay, jangan record bahagian ni. Okay, I don't want to disclose this. Okay, I don't want to be recorded on this part. Okay, I've involved in a couple of interviews before, and even during focus group discussion. And then as a research assistant at that time, I need to listen and watch the recording from the beginning until the end. Sometimes it involve multiple times of listening to this recording. Why? Sometimes the informant, okay, they mention this, okay, this is off record. Okay, this is off record. So when this is off record, I know that that part of conversation should not be recorded or should not be at least transcribed. Okay, so in this case, I always find difficulties when the researcher, especially the interviewer, they do not reaffirm when the recording should continue. Okay, say for example, when comes a certain issue, your participants say, okay, this is off record, and then he start to elaborate, explain more on the issues, but then you continue the interviews after that. So this continuation, which are basically you already gather their consent, is supposed to be recorded, but then the interviewer do not clearly mention, okay, can we continue our recording? Okay, and then your client supposed to affirm or give their consent on the continuing of the recording. Okay, so in that case, okay, a very careful and experienced interviewer, they will off the records and they will start to record again after that. Okay, but sometimes they don't off the recording, but what happen is they exclude that part from the transcription or from the analysis. But then when you involve researchers, data analysts during this time, they will not know actually when they should continue doing the transcription. Okay, because of why? Your client mentioned this is off record, but you do not reaffirm or re-clarify with them, okay, when should the recording continue back. Okay, you must be careful about that. So why? If our clients decline the recording, we must stop the recording, but ethically, we must still offer the services without penalty. Okay, unless recording is essential to the service, okay, to the service itself. Okay, say for example, you are dealing with organizational discrimination, you are dealing with sexual harassment, for example, so you try to help the clients to how to deal with their work stress. For example, you are providing employee assistance program, for examples. So when they mention that they don't want to be recorded, okay, you should not also stop the service, because it's not a requirement for the service but requirement for data collection. So we must treat them equally with the others as well. So in sum, this standard 4.03 protects our clients as well as reinforce, okay, the ethical practice by ourselves. Okay, reinforce our ethical practice by requiring us to obtain permission before creating any recording of voices or images of the course or services. So the standard, this standard strengthen, okay, the process of informed consent. It also safeguard the confidentiality and ensure that our professional services, our professional activities follow and adhere and uphold respect, okay, uphold trust and legal compliance. Okay, next is standard 4.04, minimizing intrusion on privacy. Okay, so this standard 4.04 emphasizes that psychologists must respect, okay, must respect the boundaries and avoid sharing information, okay, sharing unnecessary or irrelevant personal information about our clients, about our patients, about research participants, about students, about employees, or others with whom we interact professionally. So this standard reinforce the integrity, the dignity, the confidentiality, and the proportionality in psychological communication. So in here, okay, in this standard, we have two substandard, 4.04A as well as 4.04B. Okay, 4.04A, okay, is about report only, we must report only relevant information. And 4.04B, okay, we only discuss relevant information on for appropriate purposes. Okay, standard 4.04A. Okay, so this substandard highlight that psychologists include in written and oral reports and consultation only information germane to the purpose for which the communication is made. Okay, the key words here, germane to the purpose, meaning that when we talk about confidential information, okay, when we talk about private informations, we must limit what kind of information that we should report. So this 4.04A, limiting information to what is relevant only. Okay, this subsection direct us to include only information that is necessary and directly relevant to the purpose of our report. Okay, so we use only relevant information in our report, okay, in our consultation or in our communication. So this also applies to our reports, okay, our written reports, our research consultation, our case consultations, okay, case studies, our materials for education, for training, for interventions, or even in our legal or administrative document. So this ethical logic is straightforward. Okay, okay, why? Even if we already obtain, okay, the consent from our clients, from our informant, okay, information that do not serve, okay, any purpose, any professional purpose, should not be shared with others, okay, including unnecessary details in our reports, in our communication, may increase the likelihood of harm, okay, to the informant, okay, maybe to their institution as well. So it may also invite unintentional embarrassment or maybe stigma or even bias towards them. So that's why we should not include unnecessary information which do not serve any purpose. So this section, okay, this substandard promotes a principle of data minimization, okay, helping ensure that the individual's privacy is protected beyond our basic confidentiality standard. Okay, that's why for my students who are under my supervision, regardless whether it's undergraduates or under master or PhD students, I always questions them, okay, only question them when they include unnecessary question, especially in the part of demographic information. I noticed that when students want to develop their survey, okay, their questionnaire, they include many informations or many questions, many items in the demographic section. While in fact, they only require very minimal information. For example, they require about age, about gender, and maybe about ethnicity. But if we look at many surveys, they ask a lot of questions. They ask about occupation, they ask about educational qualifications, they ask about marriage status, okay, they ask about their location and etc. Well, in fact, this information is not pertinent or is not even needed for their report. So it's important to minimize especially private and confidential information. Okay, this will protect us as well as our client. So this is about 4.048. Only communicate, okay, information which is relevant to the purpose. 4.04b, okay, these substandards, okay, discuss confidential information obtained in their work only. Okay, psychologists discuss confidential information obtained in their work only for appropriate scientific or professional purposes, and only with person clearly concerned with such matters. Okay, only relevant person. Okay, not to everyone. Okay, not even to our partners. Okay, when we talk about appropriate scientific and professional services, so this section discuss in details, okay, the context as well as audience. Okay, so these substandards address the context and audience for sharing confidential information. So psychologists must limit the discussion to situations that meet two criteria. One, a legitimate scientific or professional purposes, and two, persons who are clearly involved and have rightful need to know. Okay, examples. Okay, examples. When we want to discuss confidential information, we must discuss with a legitimate scientific or professional services such as clinical treatment planning, professional supervision, research integrity, risk assessment, and maybe organizational consultation. Okay, and second criteria, when we want to discuss about this information, okay, legitimate scientific and professional purposes, we must discuss with a relevant person. Okay, this relevant person may include supervisors, the clinicians who are going to give the treatment. Okay, maybe we involve the third party service providers, interdisciplinary team members. Okay, if you involve in some kind of integration, multidisciplinary or transdisciplinary research, for example, research collaborators, institutional review boards. Okay, when they require you, when they want to give the ethics approval. So in this scenario, we psychologists, we must not share confidential information for reason other than professional and scientific matters. Okay, example, sometimes people have more curiosity to know. Okay, they just want to know. We should not disclose that. Okay, for personal interest, obviously we should not communicate any confidential information for personal interest. Entertainment, gossiping, or any other purposes outside of professional justification. Okay, sometimes even in professional setting, okay, for research, for examples, information must be proportional, okay, must be limited, okay, and thoughtfully we only disclose relevant information. Okay, as a psychologist, okay, scientific practitioner, we must really pay attention to this standard, okay, because these standards reinforce our ethical values. Okay, this standard reinforce that we uphold respect for privacy, we uphold protection our clients from potential harm, we enhance, we uphold professional discretion, and we protect our client autonomy and dignity. Okay, studies, okay, have been conducted in this area, so they emphasize that ethics emphasize over this communication of information, confidential information. If we over disclose, okay, if we communicate informations, unnecessary information about our clients, even when legally permissible, okay, is allowed, this can damage trust, okay, in our profession. Okay, it can increase distrust, and it can even impair the therapeutic alliance between us and our clients. So these standards, okay, standard 4.04 is safeguards, okay, is standard safeguards against this kind of over disclosure risk. So basically, if we look into this standard 4.04A as well as 4.04B, so these standards basically guide us or instruct us to share only relevant information. Okay, do not overshare information related but are not related to the purpose of scientific or professional relationships. So we avoid unnecessary disclosure, and we limit, okay, we limit the discussion of confidential information, confidential materials to appropriate professional purpose and audience only. So these standards ensure privacy is respected even when information sharing is permitted, supporting ethical communication grounded in necessity, in appropriateness, and in compassion.